I'm Allison June Mabe, Governmental Affairs Program Manager, here with Joe Stewart, Chief Advocacy Officer. It was another busy week at the General Assembly with a lot of attention focused on the state budget. Joe, what are we hearing about where things stand?
Yeah, the leadership, both House and Senate, continue to discuss some of the finer points that are left unresolved, Allison June, but it looks like maybe there'll be a budget next week, although no one's quite certain at this point. The only promise we're hearing is that there will be a budget done by the end of the month.
Okay, great. And while those negotiations continue, there's also been a lot of activity in committees this week, including movement on legislation that we're tracking.
Yeah, House Bill 356, which contains the provisions of the IIANC legislative agenda, continues to move forward. Probably a vote will be taken on that on the Senate side next week. We don't anticipate any problems there. There was an amendment added that we're talking to the representatives of the carrier groups about relative to UIM claims. We're not entirely sure what it's about, but we're looking into that as well. House Bill 34, which deals with Medicaid providers, something Jim Bergen has been working on to make it easier for the Department of Health and Human Services to crack down on fraud and waste in the Medicaid problem. And then the transportation bill came out this week on the Senate side. A couple provisions in there that are of interest about driver's license and about the notice of lapse liability for a vehicle owner and how long they have to respond to DMV. It's been extended from 10 to 30 days. But nothing real significant that we can tell, but a few things of interest that are bumping along that should be dealt with and done also next week or the week after.
Okay, so it sounds like a mix of insurance priorities and broader policy issues moving as we head towards the end of the session.
Yeah, I think we're fine in terms of the key priority items on our legislative agenda and everything else that we're monitoring, both on the PNC and health and life side. Everything seems to be in good shape at this point.
Sounds good. And outside of the legislature this week, we want to recognize the winners of our North Carolina Alliance for Safe Transportation. Our teen ambassadors earned scholarships, about 13 out of 150 applicants. They were selected this year for their work promoting safe driving habits across the state.
Yeah, and finally, our I Heal Minute, we feature Representative Dr. Tim Reeders, emergency room physician, his district down in Greenville, North Carolina. Talks to Allison June, a little bit about what it's like to be a medical provider when you're dealing with healthcare and health insurance related public policy issues.
Okay, great. I'm here with Representative Dr. Tim Reeder, an emergency physician in the Greenville, North Carolina area. Representative Reeder, you're also on a chair of the House Health Committee. How does doing that, but also being a physician, give you influence and insight on healthcare and health insurance public policy related issues?
As a practicing emergency physician, I see firsthand the challenges that patients have with both access and affordability for healthcare. Access is really important because we know if we can get care locally with their primary doctor, not only do we have better outcomes, but we have better cost avoidance. The other thing that I'm working on really is to look at how we can make health insurance much more affordable for everyone. We know that the cost of healthcare is going up much more quickly than other costs. And as a policymaker, we need to identify and deal with things that help make insurance and healthcare more affordable.
Awesome. Thank you. And thank you again for helping us with some traffic safety initiatives like the World Day of Remembrance event last year in Greenville. We hope to see you again this year.
Well, the partnership that we have with the insurance agents is really important, both for public safety and all the work that they've done on preventing accidents.